Hello, my name is Anthony Choi, and I'm a transplant hepatology fellow at New York Presbyterian Cornell, Columbia. And with my mentor, Dr. Robert Brown, we'd like to talk about hepatocellular carcinoma and its treatment options. Thanks for tuning in. So, what is hepatocellular carcinoma? It's the most common type of liver cancer, and it occurs mostly in patients who've had long-term liver disease. It might be referred to as HCC for short, or just plainly liver cancer. Risk factors include patients, like I said, with chronic liver disease, but most often they've already have had to develop cirrhosis or scarring of the liver. Hepatitis B is also another risk factor. It's said that up to 1/3 of patients with cirrhosis may develop liver cancer in their lifetime. And so there's a big push for patients and doctors to be on top of diagnosing it as well as treating it. Symptom-wise, you may never even know you've developed liver cancer because you may not even feel it. There are signs and symptoms of liver disease, however, and we'll talk about that in a bit. But like I said, you may not feel it, but you're at risk for liver cancer, so there needs to be a way to detect it, and that's why we do screening for HCC. And that may include ultrasound or MRI, usually every 6 months, just to keep tabs on your liver. Liver disease can come in many forms, of course. Signs and symptoms include yellowing of the eyes or skin, swelling of your legs or belly, just overall fatigue or abdominal discomfort. Blood work that may tip you off that you've developed a bad liver include an elevation in what's called AST, ALT, alkaline phosphatase, bilirubin, and even INR. What causes liver disease? Like I said, there are many causes. Most commonly, especially in America, is obesity and alcohol, which are on the rise, but also viral hepatitis, such as hepatitis B or C, or autoimmune hepatitis can cause liver disease. And if severe enough and you've had it for a long enough time, might develop into cirrhosis. In terms of treatments for hepatocellular carcinoma, your options are many, and it really depends on, the size of your tumor as well as how healthy you are, and several other factors as well. One option for your HCC could be surgery, where a surgeon will just cut out the part of the liver that's been affected by the cancer. Another option is ablation, in which an interventional radiologist can get very close to your tumor by accessing your blood vessels and apply energy close to the tumor and thus killing the tumor cells. Another option by the same interventional radiologist is embolization. This is another non-surgical technique in which they can block off the blood vessels that actually feed the tumor and thus killing the cells that they want to target. Liver transplantation is another option. And in this case, the surgeon removes your old liver and is able to put in a new liver. It often requires a very close relationship with your hepatologist who will guide you throughout the whole process. Next, we have chemotherapy, in which an oncologist or a cancer doctor is able to infuse medicines that are toxic to the cancer cells and thus killing them. And they can also try immunotherapy, in which certain medicines can utilize your immune system in order to target and kill the tumor cells. Lastly, we have radiation, in which a radiation oncologist can irradiate the tumor from the outside in and thus again killing the HCC. As you've heard, you may have a lot of different doctors trying to treat this HCC, and it'll really depend on your tumor size, the location of your tumor, and your overall health. So if you have liver disease, ask your doctor about hepatocellular carcinoma screening. The earlier it's caught, the better outcomes you'll have, and the more options you'll have as well. Thanks for tuning in. Goodbye.